Good afternoon, everyone. This is Tanya Williams from the Division of Child Care and Early Childhood Education. So just want to welcome you all to the call, and as always, say thank you for everything that you're doing out there to keep children safe and cared for and nurtured. We do so appreciate that. I'm going to give a couple of updates, and then we're going to have one of our colleagues share some information about some other communicable diseases that are going around. And also just want to let you guys know I'm fighting a little bit of allergy stuff, which is not fun during a pandemic because every time you cough, you think everybody's looking at you like something's wrong with you. But so my voices may give out a little bit. But anyway, again, welcome to the call. I know we'll have people joining us, and just want to welcome all of you. I know it's a busy time as we go into the next few weeks. Many programs are kind of resetting. Even if they're not school-based, we kind of have a restart on the school year and have children moving and transitioning. So I appreciate you all for taking time out. If you will go ahead and go to the next slide, Brenda. So as you can imagine, and I'm sure many of you are watching what's happening and probably living with it, we are starting to see some intermittent closures kind of creep up again. We kind of had, probably 10 for several months, about 10 closures that were pretty consistent, with many programs really just closing a classroom in general when they had a positive case. But what we're starting to see now because of this, and I'm not going to get into specifics. I know that Dr. Tumlison talked about the Delta variant, but this variant, is proving to be very challenging. And we're starting to see some very concerning things, both for young children as well as young, healthy people. So we have about 26 programs closed. I ran these this morning. I don't think that's probably accurate. I think we probably have other programs that are closed. I do want to just make a plea that please report that into your licensing staff. The better information we have to paint this picture for both the governor and legislators and other people in the state, it gives our information credibility when we have as accurate an information as we can. I do recognize that many of you are just closing temporarily to clean, and I've actually talked to several providers who have had to do that because one classroom became 2, became 3. So, but right now we're showing about 1,898 programs open. There was about 26 closed. Our capacity's gone down by about 1,200 with those closures. We've expended about 65 million, so we're a little over half of the funding through the CURSA funding that we got in December. And just a reminder, as I said, to please report to your licensing staff. And Chastity, thank you. I do know that specialists are telling you guys, we pulled a lot of things whenever we ended the pandemic requirements, but we are, because we're seeing these changes and what's happening in the field, we're asking that you report your closures to your licensing specialist. So I recognize that can be difficult and sometimes you're closing quickly, but if you can just shoot an email and let them know, or even after the fact, but as quickly and as close to the date of closure. I just want to make sure that as people start asking questions, that we're able to tell them. And again, thank you. That's a great question. Just for your building, if you have to close your whole program, your whole license program, if you're doing classrooms, it's not necessary. We do appreciate that question though, but just for your program. And if you can go to the next slide, Brenda. And just this is information from Tom Shepard's unit. And I know I've heard from a few providers. We are still keying some active cases. So if you're seeing that you have some cases that weren't keyed that ended on 6:30, please reach out to a staff person. We're trying to close that on all of them. I heard from a provider just before the call and tracking down 2 for her. So if you have any children that were expiring on 6:30 that were essential or otherwise low income, please let us know. I do know we have had some that did not return paperwork that were regular low income. There could be a reason, but they're working on those reevaluations and keying as quickly as we can. I do have a little news there. As many of you know, and I've talked about this a lot, we have not retained any funding for any additional staff up until now. But because we've entered into what we're over 10,000 additional families, we do have some temporary staff that will be starting next week so that we can help you guys. And I do so apologize, but I think you can see why it's so important to get some additional staff to help with the keying of these authorizations. So I do apologize for any tardiness on our part, but it's because our staff are operating at the same level as they've operated, before, and we've actually doubled or more than doubled our caseload. So hopefully as we get those staff in, they're going to be handling all of the essential workers. And over time, I think you'll start to see some improvements with the keying. So just be patient with us for a few more weeks, and hopefully we'll get that back on track. The next maintenance payment will be in August. And I believe that's scheduled for maybe the middle of August to the latter part of August. So that we can make sure we have the correct openings and closures, but we will be paying that maintenance payment. And then the supplemental payments for June are complete, and we'll start working on processing the July payments now that we're in August. And then just an update on the American Rescue Plan Act, and I apologize for having to continue to report on this and not have any exciting news other than it's still in progress. There are, some new requirements for the state that were passed during the legislature in terms of approval. And so we have sent this over to our finance folks, which will then be going over to the Department of Finance Administration to get on the committee. And it is scheduled for the week of September 21st. We'll have a meeting with PEER, that's a subcommittee, and then the full legislative council. And hopefully once we get that approved and DFA has everything loaded, we can start pushing out the information about the grants and funding that will be available through that, which is a little bit different than what we've been doing. So just wanted to make sure you guys were aware of that. If you have any questions, please let me know. But we're waiting. We're in that final approval process with the legislature, which is a new law, and that will be the week of September 21st. So I think my colleague is going to be sharing some information with us. And I know you guys have heard from Sandra, but just so appreciate her and her commitment to children's health in Arkansas. So Sandra Withers, if you will, we'll turn it over to you. And Sandra, you're still on mute.
Thanks. So can you see those slides okay? Good. What I'm going to talk about today is, in addition to everything else that we're dealing with, there is an RSV surge that's going on this summer. If you have worked with young children for any length of time, you have seen that face. That is the face of a child with RSV. And you deal with it all the time. But this year, just like so many things, this year's different. So what you usually see is in the fall and the winter, and we all know when it's RSV season. It goes right through your program. It's very common. It's very contagious. About half of your kids will have it as a baby. And by the time they're 2, almost everyone has had it. The problem that we have this year is that we didn't have it at the normal time, and now we're having a summer surge. And the other thing that is very different this year is there are many, many more children affected. I watched a discussion about it yesterday, and they had this little peak that is what we have seen for the past 5 years that just kind of looked like a little hump, and then up to the top, which is what RSV is looking like right now. I attended the Arkansas chapter of the American Academy of Pediatrics meeting a couple of weeks ago, and I was asked at that time, could you please share some information with the early childhood folks because they know that you are frontline folks with this. You see the children, you know who's sick and who isn't. And what they want you to know is that the pediatric healthcare system is now under pretty severe strain. The ICU doc at Children's said it's like winter in the ICU right now. But unfortunately, right now we've got a surge upon surge because these kids with COVID are now beginning to pour in. So they are already full, and they are getting both kids with RSV, kids with COVID, kids with croup, kids kids with asthma. So they are pretty well getting hit hard. They're also getting kids with more than one thing at a time. There isn't anything that says you can't have RSV and COVID pneumonia at the same time. So a lot of these kiddos are pretty sick. At the time of that meeting, they were getting about 200 visits a week of kids with an RSV diagnosis. RSV tends to go up like a whack-a-mole. You know, it surges in a place and then it goes down and it surges another place. Pulaski County went down since mid-July. Jefferson popped up. Unfortunately, at Children's, that doesn't really mean anything because where do kids that are really sick go? They go to Children's. So I talked with the doc over there on Sunday, and he said there are no signs of letting up. They have not seen any decreases at all. So again, you guys know RSV, you've seen it many times, but I'm going to do just a little short review of what you need to watch for. Remember that most kids with RSV, it's going to just look like a juicy cold. They're going to have that pouring the runny nose, pouring eyes, a cough, but with a lot of children, it will progress, especially the babies. They're going to wheeze, they're going to breathe fast, they're going to have retractions where the muscles in their chest are helping them breathe. So that can progress to more serious symptoms. We're especially worried about the babies. We also worry about people over 65, especially those who have asthma or who have other respiratory conditions, because they also can get RSV and get sick with it. It is by far the most common cause of pneumonia and bronchiolitis in our babies. So again, this isn't it. That part's not anything new. You know this. You've seen it every year, but we particularly right now we've got to kind of keep an eye on it. It is also harder on kids with asthma, special needs, and you know who your ex-preemies are, and those are kiddos that may have done, maybe they were born back in the winter and they've done really well. And you're thinking, oh, we're kind of home free until the fall. But this summer, the RSV is hitting. A reminder that RSV is a virus and antibiotics are not indicated. Even if they go in the hospital, it's for supportive care. So don't feel like you have to go, oh, well, they've got RSV. They need a prescription for antibiotics. That's not the treatment for RSV. So basics, how many times have you heard this year? Wash your hands really, really often. For heaven's sakes, don't touch your face. If you have the virus on your hands and you touch your eyes or your nose, you've just inoculated yourself. Cover your coughs and sneezes in your elbow. Unlike COVID, RSV spreads really easily from surfaces. It lives a long time on surfaces. So for all the reasons that you already do this, especially want to make sure to clean your toys, make sure you've got your dirty toy basket and you put it up so that the kiddos don't share that, your doorknobs, your toilet handles, your phones, your cell phones, all of those things need to be cleaned and disinfected really often. Again, stay home if you're sick. This is not the time to take chances on people who are ill. Sending sick kids home is really important, and keeping them out before they're ill. I mean, before they can spread it. to the rest of your room and the rest of your center and the rest of your staff. So what the pediatricians specifically asked me to remind you of, in addition to the things that you already know and already do all the time. One is to think about this. If you have a child with RSV or a child with COVID or a child with some of these other viruses that they're seeing, they can all look alike. That a child with each of those things can all look alike. But the isolation, the length of time that they need to be out is very different. So what we want you to do is encourage your families to contact the PCP and see if they want to test for it. A lot of times in the olden days, back before COVID, we would just diagnose RSV by, it's RSV season, it looks like RSV, they're not having any issues. But now it's more important for a lot of the docs really do want to test for RSV, and we absolutely want to test for COVID, right? Because we want to keep open, we want to be serving kids, we want to know if we've got COVID in our centers. The second thing is, again, they are quite overwhelmed. The pediatric offices are busy, children's is busy. We want to do things that make a difference, but not things that don't. So for RSV, if we know that a child has RSV, they've had the test, we know that's what it is, it's not COVID, they can come back to the program. They can return to your center whenever their symptoms improve and they don't have fever. There's not a particular length of time that they have to be out. Okay, so this is coming straight from the pediatricians. It is not necessary for you to send them back to say they've got to have a negative test or you've got to have a doctor's note, because all that's doing when you send them back to the pediatrician is it's adding another visit. It's stressing the system even more, and it really is not making any difference as far as the actual course of this. So if they have RSV, they're feeling better, the fever is gone, they're breathing well, everything is good, they can come back, and a doctor's note is not indicated. All of the pediatricians, again, strongly recommended face masks. They are, again, quite overwhelmed in their practices and at children's, and they are strongly recommending face masks for early care and education and for schools. So again, we're looking at a double whammy here. We're looking at RSV and for COVID. If you want to read more about RSV, healthychildren.org is a good site. If you forget about that, you can go over to Healthy Child Care Arkansas on our Facebook page. There's a post about it with a link there that you can go to and read more. And I always have to end just like Tanya does. Thank you, thank you, thank you. Thank you for all that you do. I've worked with the division now. I looked at it, Tanya, it's over 12 years now in some form or fashion. And I do it because I absolutely love early childhood. I so respect all the things that you do. You make such a difference in the trajectory of these kiddos' lives. And I am like you, I am very worried about the long-term impact on the children of having lived through this. I know grandparents and parents who lived through the Depression, who lived through World War II, and it changed them in some way. And it was something that, it was a lifelong effect of having lived through that. But right now we are living through it. And there are things that we can do. The things that we can do are all the things I just mentioned to keep the infection rates down. Also, I implore you to consider the vaccine. I know that we're going to put the links in the chat for how to access those. If you are on the fence, if you've got questions, if you still have been waiting, talk to somebody that it is in your community, talk to your pharmacist. You may or may not be able to reach your healthcare provider because they are pretty swamped right now. If you can, if you have a way to do that, ask them. Every pediatrician I know is strongly in favor of vaccines for 12 and over. If you have teenagers, this is something we can't just isolate one group. It's all of us. So my grandkids are vaccinated, took them just as quick as I could. And I strongly believe in the importance of it. I'm going to put there's my contact information. I've talked to lots of folks who just emailed me or they called and say, what do you think about this? Or how do I find out about that? I'm glad to put you in touch with good, solid information so that you can make the decision that's right for you. So I will turn it back over, stop my share, and turn this back over. Let's see.
Thanks so much, Sandra. We always appreciate you and your information so much. And again, thanks to the colleagues out there listening. Kelly has posted in the chat box the vaccine information. I do want to share, and I'm not a health expert, but we really are encouraging everyone 12 and older to get the vaccine. I'm actually going to host a Q&A with my staff here in the division in the next couple of days with a nurse practitioner to talk to them and answer any questions. As you all are probably experiencing outages, we are too. And so, and sometimes it's related to someone who hasn't been vaccinated. So we really are encouraging. We can't mandate it, but just really want you guys to get the information you need to make informed decisions and help your program and your children be able to be served. So I also asked Kelly to post the guidance. If you'll remember, and I'm still wearing my mask just so that you all know when I am outside my office and going out in public, but just encourage you to do that. The information that we have now is guidance. We had requirements, if you'll remember last year, but I believe around April or May, we switched those to just guidance. But I have talked to several programs who have called me in complete despair and frustration, who have had to close their entire program, and they were doing everything, but possibly had, members from the community, family members coming in, and that has impacted their program. So, I encourage them to make sure they got the information to the families they serve about the vaccine and vaccine finder. So I think we all have to do our part. I'm not, I respect everyone's own right to choose, but I think we're starting to see some things that are highly, highly concerning with regard to young children and their ability to fight off this deadly virus. So just stay informed, stay tuned. If you have questions, if you need help with that, Sandra's made an offer. She certainly has colleagues that she can identify that could partner with your program to answer any questions if you want to set up something with your staff and or parents regarding the vaccine or just COVID. But just again, appreciate everything you're doing. Kelly, I see a question in there, and if you could talk, put you on the spot here, but if you could talk a little bit about the Arkansas Department of Health hotline and what's happening over there, that might be helpful here. But I see a question that they're behind. And so Kelly can probably tell you what's going on from her perspective and from what we know.
Yeah, I saw the question about being behind and can't guarantee positive employees will get their release letter in a timely manner. So that hasn't been my experience the last day that I was over there. We did have people still getting their release letters timely. I will check on that for sure. They do them a little different now. They do those on the front end instead of on the back end. So when you go in and get a positive test, you get your letter that says you will be released on, and it's 10 days from usually the date of the test or the onset of symptoms, but it's 10 days. And it's unless you have continued symptoms, like if you still have a fever at the end of the 10 days, then you couldn't come back. But there are some residual effects that, like if you're still coughing, we know that those coughs linger for a while. So that one, they would allow you to still come back, depending on your symptoms. So I will definitely double check on those release letters, but I have not heard that. We do still have someone there. Now we have a licensing person there daily. So when people call into the hotline, if you have specific childcare related questions, we do have someone there daily to answer those questions.
Thanks, Kelly. I appreciate that. We've seen quite a surge of phone calls over at the Department of Health on that hotline. So that's why we're staffing it the way we are right now. I suspect for those of you in the school world that we'll see that switch to school questions shortly as we get back into the start of the school year. We tend to see that, or we have during the pandemic, kind of shift back and forth. So I imagine there'll be a lot of calls from schools as we get back into the school year, but we will continue to work with the Department of Health to try to answer questions for our early childhood and childcare folks. A question from Jennifer Easley. Kelly, I don't know if you want to take
it. Yeah, just noticed that one too, Tanya. So the ADH is giving you guidance. So you would still call when you have a positive case, you would still call them, and they are giving guidance on quarantine, and it is consistent with the CDC guidelines. So you'll find that they're telling you the same thing as the CDC has put out. But anytime you have a positive case, just give them a call and they'll walk you through the quarantine timeframes.
And Brandy, if I could impose on you for a second, would you post in the chat box the information? I've had a few providers reach out to me about, and I think we're seeing the surge about COVID absentee waiver. So for those children that may have used up their absentee days, and we're going to extend on the voucher program some additional time. If you'll post that in, just want to make sure everybody's aware of that. If you have children that have exceeded their absentee days that are on a voucher, you can request additional days. And I think we're going to need that as we're going into the coming weeks. We're starting to see more and more cases. So just want to make sure you have that. And I appreciate you, Brandy, for doing that. I don't see any additional questions, gang. I hope that's a good sign that things are on track and going well. And I spoke too soon. Can essential worker vouchers qualify for the waiver? Yes. I see some nodding heads from the family support team, but yes, they do. So if you have an essential worker family that's exceeded absentee days, absolutely, you can submit that. And it is just for COVID. Those additional days are just for COVID. I understand that's RSV is happening too, but the funding that we have is very specific to COVID relief. So my apologies there, but we have to follow the federal guidelines, gang. I have had a lot of folks reaching out about additional regulations, and we have nothing to report at this time. No changes. The guidelines that we have that are on our website that went into force, or the guidance that we've put out there, is what's in place. I highly encourage all of you as programs to take a look at that. I know I've heard from a number of programs that have never stopped doing screening and wearing masks and all of those things as precautionary things. So, and I think you heard from Sandra Withers that the pediatricians are really encouraging that with young children. You know, I can't stress enough, we are seeing some very different things. When you start hearing about children dying, but at Children's Hospital, they're at real capacities with COVID patients. So we just want to make sure that we're doing everything we can to keep children safe, gang. So just, you know, if you have questions about that, you know, if you want to talk to somebody in the healthcare profession, as I said, I'm not a healthcare professional, but, you know, Sandra is always available. And you just reach out to us and we'll connect you with someone that can answer questions. But, you know, just would encourage you to look at the guidance. It very much is in line with CDC and what the Department of Health has been able to put into place. And we just encourage you to follow those, as well as reporting in any closures. I'm just going through to make sure I haven't missed anything. And Brandy, there's a question from Lance Johnson about who their current contact is. If you can, it could be a number of staff, but we'll get you connected, Lance, to make sure we take care of any concerns that you have. Brandy's posted in the waiver information that is in place. And Rachel has also put in the chat box, thank you, Rachel, information about the deep cleaning. We still have funding, and we'll continue to have that resource available for you. I think we're probably going to need it in the coming weeks. So if you have a positive case at your facility and you need to purchase either supplies to do the deep cleaning, or you contract with a company to come in and do it, please keep those invoices and submit them for reimbursement, because we can pay for those and have been doing that throughout the past year. So we want to continue to do that. The information Rachel has posted, it's the email address is deepcleaning@dhs.arkansas.gov. A question from Chris Minka. I think, Sandra, if you could look at that, if you don't mind, it's about fully vaccinated employees. And if we need to take that one as I say, a placeholder, we can get something out, gang. I don't know, Sandra, if you feel comfortable. Kelly, if there's anything from the health department, but it's from Chris Migna.
I saw that, and I am not aware of any changes there as it applies to early care and education. But that is that's what I read yesterday. But I'm going to look at that while you guys go ahead. Okay.
Okay. Thanks, Sandra.
Sure.
Appreciate that. Yeah, nothing on our side, Chris. I think, I would follow. I mean, I think if someone's been exposed, even if they're vaccinated, there's still some risk. I mean, we have seen breakthroughs. If you're not aware of that, please be aware that there's a small percentage of individuals who have been vaccinated who have had what's called a breakthrough. So, we certainly want to encourage, quarantining to the degree possible until we know that person, is safe. They're probably going to have, as we understand, fewer symptoms and be less likely to be hospitalized, but they still could carry the virus and potentially spread the virus. So I would encourage you to also partner in your local community with, health professionals when you have these questions. It's a good thing to have that partnership in place so that you can reach out to those. As Sandra said, there's a lot of stress on the system, but Department of Health and others, there may be somebody that's within your community that would be willing to try to answer some of these questions for you, or maybe your own physician. But please feel free to reach out to us. And Sandra, anything to add to that?
I can just read exactly what it says. The recommendation is, if you've had if fully vaccinated people who've had a known exposure, to be tested 3 to 5 days after exposure, and then to wear a mask in public indoor settings for 14 days or until they receive a negative test result. One thing I will share, it's personal, Tanya, but my son, who is fully vaccinated, and my grandson, who is 6, of course, not vaccinated, are both right in the middle of COVID right now. So you can get COVID even if you do everything right. And so there's no implication that people who get COVID have done things wrong. This Delta variant has completely changed everything. It is so exquisitely contagious that it's very, very easy to catch it. My son would not mind me telling you this. He has been very sick, but he didn't have any indication that he needed to go to the hospital. He's recovering at home. It's been about a week. It kicked him hard, but he's beginning to get over it. Even for the little 6-year-old, he was pretty sick with this. It was like a pretty bad flu. So even with this, even vaccinated, even with precautions, things can happen, but we want to minimize this. We want to minimize it. And so hopefully what has happened, it's limited. He didn't have to go to the hospital. It's made it, I can only imagine how severe it might have been had he not been vaccinated.
Thanks, Sandra. Appreciate that personal testimony. I'm sure there are others on the call who are experiencing some personal things at this point around our state. So I know there have been a couple of questions. Brandy's responded to several in terms of the time frame. Please know that the wait times are as much about the staffing situation, and I've mentioned to you that we are getting some extra help or a temporary staff that will be coming in pretty soon, and I think that will help. But do so apologize for those couple of days wait time that you're having to deal with. But if you're, and I see several of you put in there, and Brandy said, reach out to her. If you're dealing with a specific situation where you have reached out and have not had any luck getting anybody, let Brandy know so that they can research it and help correct that situation. So appreciate you, Brandy, for all that. And I do not see anything else in the chat box, gang. I just want to wish you guys, a wonderful start to a new program year as you're transitioning babies up to toddler rooms and toddlers to preschool rooms, and some of those preschoolers on into kindergarten. I hope that all of us continue to be safe. If you have questions or need assistance, please reach out to my team. And we look forward to working with you. And we really are excited about the funding. Just stay tuned. I think in September, we'll be able to let you know we're on the schedule for a legislative committee. It's all in progress right now. And hopefully we'll have that final approval, at the end of September. And we'll be able to start pushing some additional resources out that I know that you will need and that you all need. So thank you for all your work. Take care. Be safe. Wear your mask. Get the vaccine.